on Smithsonian Channel.
December 1942. A crew member aboard the American submarine USS Silversides has appendicitis and may not survive without evacuation from the sub. Without a surgeon on board, the pharmacist's mate risks court-martial if he performs the operation. Despite all the risks, Tom Moore decides to perform the surgery. They prepare the submarine to become an operating room.
A World War II submarine that has very little sterile anything on it. These guys are breathing diesel fumes all the time. The water is not the best. It's a closed, confined environment.
Burlingame orders Silversides to dive about 50 miles off Rabaul, a key Japanese naval base. Slipping beneath the dark water, they level off at a depth of 100 feet. The submarine sits vulnerable to enemy ships and aerial surveillance all around. It's unnerving while on active patrol, let alone aboard a floating operating room.
The skipper of Silversides, Lieutenant Commander Creed Burlingame, he supports Tom Moore in any way he can. He tells Moore, I'm going to take the boat down to 100 feet, 120 feet, so it'll be stable, it won't be rocking and yawing this way and that, and you'll have a stable platform.
Moore will operate with his assistants, a radio operator, a signalman, a gunner's mate, and second-in-command Roy Davenport. They squeeze into the cramped wardroom, a narrow rectangular dining table bolted to the floor to weather rough seas is their operating table.
The instruments Moore has on the submarine, he has scalpel blades, he has a scalpel handle, he has suture material, he has gauze that he can use for sponges. He doesn't have retractors, which are going to be needed for the surgery, but he has a machinist mate take some spoons and bend the handles back. So he has his retractors, and he has some Novocaine, which he's going to use for his spinal anesthetic.
Moore measures 150 milligrams of Novocaine.
He does know the spinal procedure because he's assisted many times in the past. He rolls the patient on his side with assistance from one of the other people on his team, and they find the place where the needle needs to be inserted, and he puts the needle in, and then he very carefully withdraws some fluid with a syringe to make sure it's clear. And he's not in a blood vessel, because if he would inject Novocaine into a blood vessel, he could kill the patient. Fluid is clear, he mixes some of the Novocaine with it in the syringe, he re-injects it, and now within a minute or so the patient is unconscious and he's ready to do his work. Moore estimates that his anesthesia will last about roughly an hour and a half. He figures that's probably going to be enough time to finish this operation. And he finds the appendix rather quickly. It's adhered to the cecum, which is not a good sign.
The appendix is attached to Platter's intestine. Moore slowly and carefully pries the appendix free.
And he has to be very conscious of not puncturing the appendix, which is filled with all this pus and material from the infection.
The 30-minute surgery appears to be a success. The rest of the crew is relieved. Below periscope depth, the only way to monitor traffic from the Japanese base at Rabaul is through their hydrophones, listening for threats. But when Moore tries to close up his patient, he discovers bleeding inside Platter's abdomen.
He thought if there was a bleeder, it was inside the patient. And having not found it, he's worried that he's going to sew him up, and he's going to continue to hemorrhage, and he's going to die of internal hemorrhage.
Moore wheels Platter's intestine slowly through his hands, searching for the source of the blood, but he finds nothing. 10 minutes slip past. Then 30. And finally an hour. Platter's anesthetic starts to wear off.
You come around when your intestine is hanging out of an incision, it's going to hurt most likely, and Platter begins to moan, and it doesn't take many seconds for someone to realize our patient is waking up. and the operation is not over.
Moore instructs Davenport, Silverside's second-in-command, to open some ether to sedate Platter.
Ether is a very volatile material. It tends to settle along the floor, generally even in an operating room, but it's very volatile, it's very explosive, and the blowers are going. So anything that takes place in the atmosphere in this boat is going to be generalized to the whole boat. So pretty soon everyone on the boat is going to smell ether. So ether is not recommended for submarine service.
Nervously, Davenport spills ether onto the patient. Right away, Stiegel, who's holding the incision open using bent spoons, begins to feel woozy himself.
Davenport splashes the ether into the mask. He doesn't quite understand, and you wouldn't if you weren't trained, that you need to drip it at a certain rate, and it's a very slow rate. So if you pour it, you're giving the patient much too much ether.
Moore's amateur assistants now add to the threats the patient faces. Calmly interrupting the procedure, Moore moves over to show Davenport how to administer ether properly. With the correct dose, Stiegel also feels better. Moore returns to the surgery. For 2.5 hours, Moore searches for the source of the blood and realizes there's nothing more he can do. Moore begins to suture his patient up, knowing the unidentified source of bleeding might cost Platter his life.
As he's closing, and he's doing this almost under protest within himself, he knows something is dreadfully wrong. He doesn't know what the source of the blood is. But as he's closing, he sees the bleeder. It's right there in front of him. He realizes the clamp has slipped. He can fix this. This is easy. And he does. He fixes it within seconds. The bleeder is taken care of. He breathes a sigh of relief that he has not left this patient hemorrhaging. Put yourself in that situation where you're called upon to save a human life, and you have very few things to work with, except your skill and good luck. Tom Moore's efforts on that particular day were heroic. There's no question. The word heroism is the only word that I would use to describe what he did.
Almost 4 hours after they first submerged the submarine for the surgery, Burlingame orders Silversides to the surface. They need to charge their batteries. A little after 3 a.m., lookouts spot a darkened ship. All agree that it appears to be a submarine. Burlingame works his way around to better identify it.
Burlingame suspects